And right about now, we want to engage you on a very important conversation that touches on the healthcare sector in the country. In the wake of the COVID-19 pandemic, a lot has been exposed, indeed, including the inequality gap in terms of access to quality and affordable healthcare, and also lessons we are learning from the COVID-19 pandemic about our healthcare sector. Joining us now live is O'Brien Kimani. Is going to be engaging Dr. Austin Okoth, a medical expert from Bliss Healthcare, just to shed more light on how to bridge this inequality gap. O'Brien, it's over to you.
Broadcasting house. You've put it right. We want to discuss the issues around, the cost of healthcare here in Kenya, bearing in mind that, the COVID-19 pandemic has somehow upended the medical health or the medical landscape, not only here in Kenya, but around the world, whereby you remember sometimes in March last year, the Association of Kenya Insurers, they had said that they were not going to cover COVID-19 related complications. But then thereafter, we saw the regulator coming in and saying, no, all underwriters, must take care and must cover COVID complications. And we know that the medical health is now absolutely different because of the pandemic. And that's what we want to discuss now with Dr. Austin Okoth. He is a medical superintendent at Bliss Healthcare. He's now joining us. First of all, thank you so very much indeed for finding time to be with us. A quick one. If you look back at the year 2020 and vis-a-vis the year 2021, in the month of May, things are absolutely different in the health sector. How has everything changed?
So thank you very much for giving me an opportunity to discuss these issues. So there's been a lot of changes in the health sector, and some of the changes which I'd like to especially focus on are number one is the emergence of new diseases, and this is something which a lot of us public health experts have been really worried about and been studying. And diseases like coronavirus, the COVID-19 that have come up, is just a testament of that. And then the other change that we've seen happening a lot in the health sector is that we've been able to realize a bit more how much the health professionals within the society really take a lot of risks to bring health services to us. And we've been able to see a lot of people within the health sector pay the ultimate price for service. A lot of senior professors have passed away, and this is just a testament of how we sacrifice as health professionals to be able to make life better for Kenyans. Another very important change we've been able to see is that the use of science in control of diseases and the use of scientific approaches works very well. And I'd like to compare those situations like in Kenya here, where the lockdowns were placed at just the right time, just when the number of cases was increasing, compared to situations like in India, where you saw people were carrying on a political campaign in the midst of a pandemic, and how the Indian situation has been really bad. The number of people that have been infected and the number of people that have died is really high, and as we can see, India is still grappling with that. Mm-hmm. And then finally, what I'd like to say is just the importance of having good, strong leadership, like in our case, where our leaders really set the way forward, and they listened to the experts. And the number of people that are sick in Kenya, and even the number of people that have died, I think has been fairly well controlled compared to other countries. Mm-hmm. Yes.
We saw when the pandemic was finally got to our shores, people were first of all required to undergo a COVID test, before they could be attended to in hospitals. I do not know whether this is still the case at this point, but this definitely somehow increased the cost of healthcare in this country.
What I'd like to say is, for a lot of people might not know this, but healthcare is a right, and any health service provider should not deny somebody health service just because they think that somebody could be having COVID-19. Firstly. Then secondly, it's important also to mention that what we do normally is at the entrance we ask specific questions and we take some vitals as part of screening. it's not, in a lot of cases, it's not normal for people to be tested at the entrance before being allowed to access any health services. And if you come, for example, to any of the clinics that Bliss operates, you will see that we just ask questions, but everybody is allowed to enter. And from then, if someone has features of COVID-19, we are able to isolate them. Each of our centers at Bliss has an isolation unit and arrange for a referral where they can get specialized care for COVID-19. However, the fact that the testing is still needed in certain situations, for example, if you want to travel or if you want to engage in certain activities like in sports, you still need to show having been tested. But that also has led to the rise of cost in healthcare generally. But it's important to say that health is a right and no person should be denied health because of having COVID-19 as a disease. Mm-hmm. Yes.
And you've just put it right. I mean, it's a right. And we have also seen a situation whereby also hospitals or medical facilities, they have been forced to invest more in space, invest more in protective gear like PPEs and so much, which was never the case before. And ultimately, this cost has to be met by a patient. How have you as health companies managed to ensure that you do not raise your cost so much to force people not to come to seek medical attention?
So this is a very important point, and for people that design health policies, one of the features that you really want to make sure you have is equity. And equity is a situation whereby everybody gets what they need, so that someone who does not have the ability to get services should not be denied access because of issues of costs. So what we've been doing as Bliss as an organization is to make sure that we do not increase the costs more than what is needed. And we don't use any equipment that is not required for that specific situation. So that the level of PPE that you use for someone who is a confirmed case is not the same as the level of PPE, of personal protective equipment that you will use for just anybody that is coming for the services. Then secondly, we've been able to make sure that we offer a lot of the testing capacity in the clinics, so that we avoid that extensive referral process. And at the moment, if you come to our branches within the CBD, it's possible to get that testing right there and there. And that means we can make a diagnosis quickly and treatment can commence fast. And that also prevents patients developing complications and requiring a lot of expensive care.
Before I let you go, I want you briefly to tell me, I mean, you have been in this industry now for the last 10 years. What lessons have you learned that you think can be implemented, number one, to make the health sector in Kenya straightforward and to ensure that everybody can access good and quality healthcare in this country?
The most important thing I think we've been able to see is that it is possible to provide affordable healthcare that can be accessible to the average mwananchi. And that is very important because over time we have seen that the cost of healthcare has been rising. And if that kind of trend continues, then we will reach a situation whereby we're going to have a segment of society that cannot be able to access even the most basic health services. Mm-hmm. And at Bliss, we make sure that all our packages that we offer are within the price range that can be accessed by most of the population. But at the same time, it is of good quality so that it manages to serve the intended purpose, and it is not just people paying money without getting service that is commensurate. So that cost, we've been able to keep it down, and that is going to be very important going forward.
Very well.
Yes.
Dr. Okoth, thank you very much indeed for finding time to be with us, and all the best.
Thank you so much. I appreciate your time.
Very good. Dr. Okoth, Austin Okoth, is a medical superintendent at Bliss Healthcare here in Nairobi, joining us to help us understand what healthcare companies are doing to ensure that, number one, Kenyans access medical at an affordable cost, and of course quality is also an issue, and of course you have heard it from him. Back to you, Safin. Auma O'Brien is my name.